Due to the risk of musculoskeletal injury, when performing patient handling tasks, the patient must be able to follow instructions, and no more than 35 pounds of force should be applied by the caregiver. This video demonstrates wheelchair repositioning for patients who are not able to reposition with manual assist, and therefore use of a mechanical lift is required. This video also demonstrates an option of how to manage a patient who is past the point of no return.
Hi Maggie, how are you doing?
Oh, I'm comfortable. I need help.
Yeah, it looks like you're sliding from your chair. I wonder if someone's there to help me. Oh, Phil, could you come and give me a hand?
Sure.
I'd like you to show me how to get Maggie up in the chair because she's slidden down.
Okay, can you remember what her care plan says?
Yeah, so Maggie, you're a two-person assist with the lift.
Okay.
Yeah.
So it sounds like we're going to need the floor lift, so I'll just go and grab it.
Okay.
And we'll get her going.
Great, thank you.
You're welcome.
Phil's just getting the sling.
Alright, I've got the sling.
Oh, okay, great, thank you.
And the lift's just down in the corridor.
Okay, so we need to bring Maggie forwards. So, okay,
Alright, I'm just going to stop you there.
Yeah.
We need to be careful that you don't hurt yourself. We need to check something also before we get Maggie moving here. So the first thing you need to check with Maggie is that she's still actually sitting on the chair. So we need to find where her sit bones are and make sure that they haven't gone past the edge of the chair, which is what we call the point of no return.
Okay.
She looks to be okay here. So the next thing we're going to do is have a look at her feet.
Yeah.
And we just need to make sure they're in a good position. So we're going to have to bring them back a bit.
Okay. Can you bring your feet back, Maggie? That's it.
Excellent. Now we're going to work together to facilitate Maggie to sit up tall.
If your patient has a tilt wheelchair, ensure that the backrest is moved to an upright position before assisting the patient to move forward.
And we're going to get Maggie to help us.
Sit, hold on, Maggie.
And on the count of 3, we're going to sit forwards. 1, 2, 3.
Are you okay, Maggie?
Yeah.
Can you facilitate her there?
Yeah.
Excellent.
We won't be long, Maggie.
Here's a sling, which we're just going to slide in behind her there.
Okay. We need to tuck it right under.
Okay, so the sling should not be tucked under. It just needs to be in line with her sacrum.
Okay, just above the coccyx.
Just above the coccyx,
Yeah.
perfect. So now that Maggie is there, we can lean her all the way back. Excellent. And then we'll get the leg straps in place.
Okay, thank you.
Maggie, I'm going to get you to help me lift this leg so we can get the leg strap under. Okay, up we go. Perfect. That one's in nice and securely. Let's get the other one here and lift this leg up. Fantastic. Well done. So Hilary, in preparation of attaching the sling to the lift, we just need to remember to cross the leg straps like this.
Okay, yeah. Okay, here's the lift. So I'm just going to put the brakes on so it doesn't move.
So Hilary, I'm going to stop you there. We need to leave the brakes off because if we leave the brakes on, it's going to prevent the centre of gravity moving and the lift may fall over.
Oh, okay, okay. So brakes on the wheelchair, brakes off the lift.
Correct.
Yeah.
Okay. Now there's a number of different straps we've got here. Can you remember which ones go on?
Oh yeah, so we try and put the shortest ones at the top and the longest ones at the bottom, and that means that when we lift Maggie up, she's going to be in more of a sit-in position.
Excellent.
Yeah.
Well done. Okay, Maggie, you okay? Yeah. All right, here we go. See how the lift is moving?
Oh yeah.
Okay, we're going to stop there and just check the straps are okay.
Yeah, it looks good.
Excellent. We'll go the rest of the way. All right, so I'm going to push Maggie back. If you want to guide her back,
Yeah.
coming down, I'll guide her from the front. You ready to go down?
Yeah.
I'll get rid of the lift.
Yeah.
Just mind your feet there, Maggie. And what does the care plan say about the sling?
Oh, for Maggie, the care plan says to take the sling out.
Okay. So Maggie, you're going to help me lift your leg up here. Can you lift this leg for me? Excellent. And this one. Well done. Alright. So Hilary, can you remember how we take the sling out from behind Maggie?
Yeah, so we need to help Maggie lean forwards. So the first thing we need to do is make sure that her feet are far enough back, which they are. And then Maggie, if you hold on to the chair so you can help as well as much as you can.
We need to block her feet as well, don't forget.
Yeah, and then put our hands behind her back. And then after 3, Maggie, we're gonna all come forwards, okay? Yeah. 1, 2, 3.
Excellent, you go to there, I'm gonna pull the sling
Yeah.
out. Excellent, and
that's
we can lean back.
Excellent.
I'll go and put the sling away.
Okay, Maggie, are you ready for your meal now?
Yeah, this.
Let's just take these brakes off. And I'll just bring you to the dining table. Okay, thank you, Maggie.
Here is a quick review of important steps. As part of your point of care risk assessment, check the patient's mobility status. Check that your patient is not beyond the point of no return. Move the patient's feet underneath their body and facilitate leaning forward. Remember to encourage your patient to assist as much as possible by using the armrests. Ensure you are using optimal body mechanics. For example, bend at your knees. Keep your back straight. Use weight shifting technique. Place the sling just above the coccyx at the level of the sacrum. Double check that the sling straps are secure by partially lifting the patient before allowing the lift to take their full weight. Position the patient at the back of the wheelchair. Check the care plan for sling removal instructions. If your resident's sit bones are close to or over the edge of the chair and you cannot safely apply a sling, your patient has passed the point of no return. You may be required to guide your patient to the floor and follow falls protocol. This footage provides a demonstration of an option of how this may be done. For further safe patient handling resources, including how to manually reposition a patient in a wheelchair when a lift is not required, refer to the MSIP page on the Vancouver Coastal Health intranet. The page is located under the Employee Engagement tab.